ladies and gentlemen. I'm your host, Annalise Garrison. And today this is our third question in a series of learning how to answer SATA questions. Now, let's read the question and see what approach we want to take. Do we want to take the topic, subject, action approach? Or do we want to take the diagnosis, symptom, action approach? Let's read the question. Which of the following diet instructions are appropriate when teaching a client in the early stages of cirrhosis about her nutritional needs? Select all that apply. So we have a diagnosis of cirrhosis. So what are some symptoms of cirrhosis? Well, some symptoms include fatigue, what else? Jaundice, bloating, easy bleeding, what else? Loss of appetite, itchy skin, slow healing, dark urine, right? These are some symptoms. But these are some symptoms that come to mind when it talks about cirrhosis. We're supposed to focus on diet instructions. That is our action. So our diagnosis is cirrhosis. In our mind, we wrote down some symptoms that we know of cirrhosis. And our action is we're going to answer, select all that apply as it pertains to diet instructions. All right? So it says here, number 1, limit your calorie intake so that you don't become overweight. Well, one of the symptoms of cirrhosis is weight loss. So I would not pick that one because it's talking about gaining weight, not losing weight, right? Number 2, an adequate intake of protein is important to your health. This is true. People that have cirrhosis of the liver need protein. So I would pick that because it pertains to diet instructions. See, that's our action. Number 3, I encourage you to eat small, frequent meals. This is true. I'm going to pick that. That's the healthiest way to eat. Number 4, restrict your fluid intake to 1,000 milliliters a day. Well, one of the signs of cirrhosis is bloating, but they're not bloating due to fluid intake. Nobody said that their kidneys weren't working, right? So, I would not pick that one. I would not pick 4. And number 5, limit your alcohol intake to 1 glass of wine per day. Well, if you have cirrhosis, you should drink no alcohol, right? You should abstain from alcohol. So, I would pick 2 and 3. So in closing, the answer is 2 and 3, and I'll read the rationale. Appropriate diet instructions for the client in early stages of cirrhosis include ensuring an adequate intake of protein and eating small, frequent meals. There is no need to limit protein intake unless the patient has evidence of hepatic encephalopathy. Additionally, fluid intake is not restricted unless the client has significant ascites or edema. These typically occur late in the disease. Because of gastrointestinal dysfunction, small, frequent meals are frequently better tolerated than 3 regular meals. Clients with cirrhosis should be encouraged to increase their calorie intake instead of restricting it. Alcohol intake in any amount is discouraged. And that is the rationale for why 2 and 3 are the answers. Choices 1, 4, and 5 we did not pick. Okay, thanks guys. I'll see you in the next video.